Hey, what's up, guys? I'm David DiMuzio.
And I'm Steve Cook.
This is Hair Loss Hope, and today we are going to talk about why Dr. McGrath, who's done 2 surgeries on me, only does great surgeries. And this isn't a video bragging about Dr. McGrath. It's actually a video explaining why the deck is stacked in Dr. McGrath's favor. Once you sort of understand why Dr. McGrath only does great surgeries, it's going to help you to pick a great hair transplant surgeon for yourself, whether that's Dr. McGrath or not. So explain why Dr. McGrath only does great surgeries.
Well, he has no choice, David. The reason I say that is I'm forced, based on my own ethics, to stack the deck in his favor by screening out patients that I feel, and I know he feels, are not going to get stellar results. Now, you may say, well, gee, Steve, isn't that a little bit biased? What about those of us that are not that blessed with that strong donor hair? What if we're really far gone and have a lot of hair loss? You mean to tell me he won't help me? Not necessarily. What we're saying is that in order for any really good hair restoration surgeon to do the best results possible for that patient, he either needs to have to select the very best patients, or he has to make sure he discloses to you and me, who's not the greatest candidate, by the way, that we're going to have less than stellar results. So going back to the beginning of this video, we want to talk about why one doctor or many doctors that are board certified and specialists do only great stellar results. The reason is because they're choosing the very best patients. And what does that mean? There's a lot of categories, meaning like, are you using preventative treatments and how long? What are your genetics like? Are you a Middle Eastern with thick, ropey, strong hair in the back of your head? Or are you like me, who's been blessed with the, Western European hair where it's thin, fine, and kind of wimpy? Are you someone that has really good, facial structures where no matter how we put that hairline, it's going to look good on you? That factors into this assessment as well. So there's a lot of different things that you need as a patient to understand. That's why we put these videos out there to help you understand that. And when it comes to the majority of my work and what I do, planning for patients' procedures with Dr. McGrath, is I will let them know, hey, look, right now, today, you are not the greatest candidate. I'm not afraid to tell them that. So that's kind of how we do it. We want to make sure that we kind of funnel down to which patients would be the best candidates. Now, keep in mind, the patient that I turn down today may end up being a fantastic patient 8-9 months from now. There's a patient that I'm working on right now that has been sending a video every 30 days of his donor hair with a comb, slowly going through it. And guess what? I think it was at the 7th month mark, his hair started to really get thicker and stronger. He's a Norwood 5, borderline Norwood 6. He's going to have a phenomenal result, even in one procedure. We're not going to be able to cover the whole scalp, and he knows that. But he's a select patient that is going to go from, a bald guy to an amazing result in one procedure. He's going to look 10 years younger, and there you go. There's an example of that. He would not have had that result if we would have signed him up right away.
So if they would have signed this guy up right away for surgery, he wouldn't have had a great result. So that's part of the sort of cherry picking process, is also an education process of actually waiting to do surgery on a person until after they are a great patient. They've been well educated as to the results that they are going to receive, and then producing those results. If you're going to get a surgery done, it's really important, the consultation process. If you don't get a good consultation, you're quite likely to not actually have a good surgery. So it's just as important as any of it, is having the correct consultation and knowing that you have the right plan going into it. See you soon.